Hello, my name is Christian Chono. Hi, Dr. Jenkins. Hi, class. My presentation today will be on substance abuse, and the substance abuse of choice I pick is opioid. I will start with introduction. Opioid are derived from the opium poppy plant, or they are also created synthetically. They are used for strong pain, and they are strong pain relievers. Misuse can lead to addiction, overdose, and sometimes can also lead to death. The presentation will cover the history of opioid abuse, the prevalence of history of opioid abuse in the US, the risk factors for opioid abuse, the severe consequences associated with opioid abuse, and also potential treatment plan for opioid addiction. So we need to talk about the history of the abuse. Opioid has been used for centuries for medicine. Addiction properties are recognized for a long time. Opioid addiction became a problem since the 19th century. Widespread use of morphine, for instance, has contributed to the problem. So we also have the introduction of synthetic opioid like oxycodone and hydrocodone that have been also used for as abuse. So we have the resurgence in opioid abuse, and we continue that this continue to be a major public health crisis in the U.S. The prevalence and epidemiology in the U.S. Opioid misuse is a widespread use in the United States. Millions of Americans are affected by opioid misuse. In 2019, over 10 million people misuse prescription of opioid. The National Health of Drug Abuse reported that over 50,000 people die from opioid overdose. Opioid abuse impact people of all age, races, and socioeconomic backgrounds. Certain population may be at higher risk for opioid abuse. Neither consider opioid abuse to be a serious problem. The risk factors and the vulnerable population. Individuals with chronic pain, people that prescribe opioid for chronic pain management are at higher risk of developing an addiction. History of substance abuse. People with a history of substance abuse with other drugs that are more likely to misuse opioid. We have mental health disorder. People with mental health disorder like depression or anxiety can increase the risk of opioid abuse. Age. Young adults between the age of 18 to 25 are more likely to misuse opioid than other age groups. We have regular or heavy tobacco use people. We have people with previous criminal activities and stressful life or family issues. Those are also a high risk of for opioid abuse. We have the short-term and long-term side effect of opioid abuse. For short-term, we have drowsiness, constipation, nausea, respiratory depression. Long-term, we have organ damage, impaired cognitive function, dependence, addiction, and overdose. To continue with the sign and symptom of abuse, we have loss of coordination. We have shallow or slow breathing rate, intense nausea or vomiting, constipation, slow speech, drowsiness, shaking, and sweating. Those are the physical signs of opioid addiction. The psychological and behavioral sign of opioid addiction, we have depression, drastic mood swings, anxiety attacks, irritability, poor decision making, lower motivation, abandoning responsibilities, financial hardship, change in sleeping patterns, and less time with loved one or family. So to usually reverse the problem of constipation when we use opioid, we recommend to drink a lot of water or to use stool softener. And also for the drowsiness part, we usually do not give opioid with people who are always sleeping or who are already sedated, except this is used maybe for hospice or palliative care. Potential for overdose or use of suicide weapons. Opioid overdose is the top cause of accidental death in America. Signs of overdose, we have slower breathing, pinpoint pupils, and loss of consciousness. Opioid can also be used as suicide method. So some people um use a lot of like use a lot of tablet like oxycontin or hydrocodone to uh, try to commit a suicide. We have an example of a care plan for patient. For the pharmacological treatment, we have MAT that refers to medication to treat substance use disorder, specifically opioid addiction. Commonly used for MAT include methadone and buprenorphine. MAT aims to reduce withdrawal symptoms and cravings, enabling individuals to focus on their recovery without a physical discomfort. Methadone helps by acting on the same receptors in the brain as opioid, but with a slower and less intense effect, reducing cravings and withdrawal symptoms. The buprenorphine works similarly, but has a weaker effect and lower risk of dependence compared to methadone. For the non-pharmacological treatment, we have we can do individual therapy such as cognitive behavioral therapy, CBT, that can help patients to develop coping mechanism and manage triggers. We have support group. We can disconnect. This is connecting to connect with others who understand addiction and, who understand that addiction can be a vulnerable source of support. Another example of care plan for patient, we have patient education. We can educate patient about the risks of opioid abuse and addiction, explain the benefit and risk of medication assisted treatment. We can develop a relapse prevention plan. We have to refer also patient to specialists for pain management and specialists for mental health support. Follow up. We can do follow up with patient with addiction. We can have a regular follow up appointment. We can schedule a regular follow up appointment. It's also crucial to monitor program. It helps to prevent relapse. In conclusion, opioid abuse is a complex public health issue. With proper education, prevention strategies, and comprehensive treatment, we can support individuals struggling with addiction and strive for a future where opiate misuse is significantly reduced. This is the end of my presentation with the reference page. Thank you, class. I hope you enjoyed.